Qualified Medicare Beneficiary, or QMB, is one class of Medicaid referred to as Medicare Savings Programs. These programs exist around the country. About 7.8 million Americans are enrolled in a QMB program according to CMS. But qualification standards can differ between states, so this video is limited to Florida's QMB Medicaid program. Qualified Medicare Beneficiary enrollees have no obligation to pay Medicare deductibles, coinsurance, or copays. Rather, state Medicaid programs pay these costs. QMB is also designed to help reduce the cost of prescription medications. Because these costs are generally covered in a skilled nursing home setting, QMB applicants are almost always those on Medicare who live at home, in an independent living community, or assisted living facility, an ALF. QMB helps pay for prescriptions and copays. Those enrolled in the Qualified Medicare Beneficiary program will get their Medicare Part D premium reduced or covered completely through the LIS Extra Help Medicaid program. This will result in most medication costs, all prescriptions that are Medicare approved, requiring a copay of $0 or $10. In addition, Qualified Medicare Beneficiary enrollees will not have to pay copays or coinsurance when they seek treatment from a Medicare medical provider. While Medicaid Waiver programs also include the benefits associated with QMB, QMB has the additional benefit of no waitlist. QMB also gives you extra money. What attracts most people to the QMB Medicaid program in Florida is the drastically reduced or sometimes eliminated prescription drug coverage, along with the benefit of no longer having to pay a copay or coinsurance with doctor visits. But in addition, there's an actual cash benefit as well. QMB also pays for Medicare Part B premiums. As a result, most Floridians will see an extra $145, the typical Medicare Part B premium, deposited into their bank account each month. Those funds are extra help to pay for the costs of living in Florida. Between saving money by not having to pay copays and literally receiving extra cash in their pocket by not having Medicare premiums automatically deducted from their Social Security income, QMB makes a significant difference in our clients' lives. For those who do not immediately qualify for the Qualified Medicare Beneficiary program because of their income or assets, our experienced Medicaid planning lawyers can provide legal and ethical ways to protect your income and assets to qualify for QMB in Florida. In other words, if your assets or income are currently too high to qualify for QMB Medicaid in Florida, we can still help you with proper Medicaid planning. You won't have to wait 5 years, sell your house, or go broke before being able to obtain QMB Medicaid in Florida. In order to qualify for QMB, the applicant must either be 65 or older or deemed disabled. This can be an incredibly valuable program for those who pay significant amounts of money trying to control diabetes or for cancer treatments and medications. For those under the age of 65, unsure if they are considered disabled, should know that certain cancer diagnoses and neurological diseases, acute leukemia, non-Hodgkin lymphoma, gallbladder cancer, liver cancer, thyroid cancer, small cell cancer, ALS, Huntington disease, Lewy body dementia, and other dementias, giant axonal neuropathy, and many others, will automatically deem someone disabled. The difference between QMB and Medicaid Waiver program in Florida. Medicaid Waiver is for those Floridians who need help paying for home health care or ALF bills. For those already enrolled in a Medicaid Waiver program in Florida, they will receive all the same benefits of those who only have QMB. In other words, QMB is really for those Medicare recipients who don't yet need help with their activities of daily living, but who are in need of assistance paying for health care and prescription medications. In addition, QMB does not have a waitlist, while the Medicaid Waiver home and community-based Medicaid has a waitlist that lasts for months and months. We often assist our Medicaid clients who need assistance with their activities of daily living with strategies to qualify and apply to both programs. The primary benefit to applying for both QMB and Medicaid Waiver benefits in Florida is to start receiving QMB benefits now while waiting to come off the Medicaid Waiver waitlist. Tips for those already enrolled in QMB Medicare. Medical providers are not allowed to bill QMB participants for certain Medicare-related costs. It's literally illegal. If you get a bill for Medicare deductibles, coinsurance, or copayments, make sure your doctor or medical provider knows you are in the QMB program. If your provider won't stop billing you, call 1-800-MEDICARE. If your medical provider has placed you into collections for these charges and a debt collector is calling you, file a complaint with the Consumer Financial Protection Bureau. Their phone number is 855-411-2372. Finally, if you are already receiving Florida QMB Medicaid benefits and are starting to have difficulty with your activities of daily living, it may be time to apply for the Florida Medicaid Waiver program, home and community-based services to help pay for home health care or ALF care. There is a waitlist, and an elder law attorney who focuses on Medicaid planning can assist if you need help. To learn more, please visit elderneedslaw.com.